So, good evening, everybody. Hey, have you guys heard about this new movie coming out called Constipation? No? That's because it hasn't come out yet. Or how about this one? Did you hear that they found out that diarrhea is now hereditary? It's because it runs in the genes. Okay. All right, it's a couple icebreakers. So thank you guys for coming out tonight in this weather. I'm really excited about this talk. This is kind of my bread and butter talk, and it really kind of explains health on a whole. And because with Dr. Google at our fingertips and all the information that is out there, how do you know what is true when it comes to the body and health, and what is purely marketing and advertising? So I promise you, tonight we're going to be talking about digestion disorders. So by the time that everybody walks out that door in the next 90 minutes, you are all going to become experts on the digestion system, because there is a cause and effect relationship that occurs in the body. Something has to happen first, then it's going to cause this to happen in the body, and then this and this. So it's a domino effect. So we're going to focus tonight on these first two dominoes of what is causing digestion issues in the body. And because a lot of times people are chasing the 9th and 10th domino and chasing symptoms around the body, which is why people don't get better and why they have chronic issues. So I want you guys to all understand that both health and disease begin in the gut. So tonight we're going to be talking about shifting our community's consciousness from a disease care model to that of a wellness model, to inspire and empower you to fully own your health, but also too, for you to share this information with your friends and family and people that you care about that may have particular health issues. So I don't want this conversation to end here tonight. When you guys leave here, I want you guys to be talking with this about people in your circle of friends and family, because people don't know what they don't know when it comes to health, and they don't know where to turn to. And all you do is chase symptoms around the body, people never get well. So tonight we're going to be talking about the digestion disorders. And the 6 most prevalent digestion and bowel conditions, according to the stats on the government website, we have GERD, gallstones, Crohn's disease, ulcerative colitis, irritable bowel, and chronic constipation. So depending on where it's at in the bowel, right, GERD and gallstones affects more of the upper GI with your stomach and the first part of the small intestines. Crohn's disease affects more of the small intestine, ulcerative colitis more the large intestine, and then irritable bowel can be either small or large intestine, and chronic constipation is more in the large intestine. So it just depends on the location in the GI system. So here's just an example, right? Small intestine's more in the inside of your belly, and the large intestine is more along the outside. So when we're talking specifically about constipation, constipation means that a person has 3 or fewer bowel movements in a week. The stool can be hard and dry and sometimes painful to pass. So their definition of constipation is 3 or fewer in a week. So then my question to you guys, well, what is a normal bowel movement? How many times, or what's the frequency that we should be going? What do you think? Once a day?
What keeps you pregnant? What keeps you feeling? I mean, everybody's a little different.
Sure. Okay. So you're saying once a day? You're normal. Okay. So the normal bowel movement should be anywhere between 2 to 4 bowel movements a day. That is normal. That's how you know you're running a tight ship. 30 to 60 minutes after you eat, you should have a bowel movement. That is normal. So technically going once a day, you're constipated, because your entire gastrointestinal tract has its own nervous system, and it has reflexes in it. So when you put food in your mouth and you swallow it, your stomach expands and it starts the peristalsis, or the rhythmic contraction in the intestines. So then that should be squeezing things through, so after you eat, you should have a bowel movement. Now there are lots of other things that are involved with that too, like can you actually digest the food that you're eating? Is there any inflammation going on, and is there enough hydration and fiber in your diet? So there's lots of things that are going on with that, but that is what normal is. So when we're talking about statistics, digestion disorders affect 60 to 70 million people, causes 48 million ER visits a year, hospitalizes 27 million people, 81 prescriptions are filled, and causes almost 250,000 deaths per year. So these are people that have the issues and symptoms severe enough where they actually go to their doctor or go to the ER. But what about for people that don't have those symptoms that are severe enough and they try to self-medicate with over-the-counter medications? So there are 4 top-selling over-the-counter medications. What do you think is the top of this list? What do you think? You guys didn't know you have to think tonight, did you? Pepto-Bismol, okay. Pepsin, okay. Tums. Metamucil, okay. Everything that was mentioned are all great guesses and they all deal with the digestion system. But the first one is cough and cold medicine for the immune system. Second one is anti-inflammatories because people are in pain. And then you got your heartburn, your antacids, and then your laxatives. So when you total that up, you got $17 billion in over-the-counter medications every single year. So let's just kind of take a step back and look at this. So let's look at these systems in the body that these are affecting. So the first 2, the cough and cold medicine and anti-inflammatories, which system is that affecting? That's your immune system. And then the second 2, the third and fourth, is your digestion system. So people are going to the store because they have an issue with their immune system and their digestion system. So I just want to kind of put a pin in that and kind of be aware of that because we're going to circle back to that towards the end of the talk. Now my mentor, Dr. Loomis, he states that normal body functions cannot be restored and health cannot be maintained by using drugs because they all have side effects. Drugs are made to interfere with human enzyme systems. So if there's one condition that caused all of these issues, would you believe me? And what is it? Inflammation, okay? Any other guesses? Leaky gut, okay? What about this? Anybody have this? So before we get into looking at solutions, let's first talk about that stress survey for a moment. So by a show of hands, that first section on the stress survey is a list of symptoms that people have. So by a show of hands, how many of you have at least 1 or 2 or more of those symptoms on somewhat of a frequent basis? Okay, a good majority of you. And then that second box has to deal with activities of daily living or how those symptoms actually interfere with your life. And how many of those things is it affecting, right? So why does the body give us symptoms?
So we do something about it?
So, well, that's what one would think, to do something about it, exactly. But it's the check engine light that comes on, right? So are you the type of person, when your check engine light comes on in your car, that you take it into the mechanic that week, or do you wait a month or 2 before you take it in? It's the same thing with the body. When we have a certain set of symptoms, it is the only way that our body can actually communicate to us that something is not functioning properly. How many times you're out in your family or friends and people, oh, I have my normal headaches. Well, what the heck is a normal headache? There's no such thing as a normal headache. But that's what people think and believe because it is common for them. So let's talk and dive into stress. There's this medical doctor, Hans Selye, that had a brain on him and studied stress most of his life. He earned 3 doctorate degrees, a medical degree, a PhD, and then a Doctor of Science. He spent 50 plus years researching stress and its effects on the body. He wrote over 1,700 scholarly papers and 39 books about stress. He's known as the father of stress and was nominated several times for the Nobel Peace Prize. So what did he have to say about stress? Well, Selye found that stress has a specific cascade of physiological events when a continual demand is made upon the body's ability to adapt. So what he found is that it first starts with stress. Then how does your body react to stress? Well, it sets off the alarms and rings the bells. Then your body becomes resistant. It becomes exhausted. And once your body becomes exhausted, then what happens? We get symptoms. So if we take a look at where the stress is at and remove it, your body will then be able to respond and heal itself naturally. But if that stress is still there, then what happens? Well, then we get diagnosed with the disease. If it continues to go on, your body's going to degenerate, and then ultimately, you're going to take the big dirt nap. So when he was talking about stress, in Selye's lexicon, it could be anything from a prolonged food deprivation to an injection of a foreign substance into the body to a good muscular workout. By stress, he did not mean only this nervous stress, but the non-specific response of the body to any demand. So how many of you feel like this some days? Okay. So before we get into Selye's conclusion, I want to throw this out to you guys. When I say the word stress, what does that mean to you? Like, how could you define it or identify with it in everyday life? What does that mean?
The lack of peace.
The lack of peace. I like that. That internal peace, absolutely. Tension, okay. Anxious. It's a lot of different definitions, right? It's kind of, when we're talking about stress, it seems like it's this big, vague word, and it's got a lot of different definitions to it. And the reason why I'm saying that is because to your brain and your body and to Selye, it is very specific. And what he found is that stress is a specific entity unto itself. But the interesting fact about all of his work is that it is the only disease we have to fight. But what people don't realize is that it comes in three forms. We have mechanical stress. We have emotional stress. And then we have nutritional stress. So look at this for a moment. We got, what is this? M-E-N. Men. Men make us sick. So when we're talking about mechanical stress, what are we really talking about? Well, it can actually start at birth. Being birthed through the birth canal or having a C-section can place a lot of tension on the baby's spine, especially the upper cervical spine, and can cause subluxations that we're going to talk about in a moment, and can impede neurological development and things like that. So every baby that is born, the very first visit that they should go to once they leave the hospital is to go see a chiropractor and get checked for subluxations. So it can actually start at birth. But then you have, falls, ice stairs, car accidents, physical work, a lot of lifting, twisting, bending, sports, recreational, workout injuries, household chores, repetitive stress, but also posture, which not a lot of people talk about, but people walking around like this all day is a huge stress to your nervous system, as we're going to talk about in a little while. And then something that chiropractors talk about, which is subluxations. Now, how many of you guys understand what a subluxation is? Or don't understand what it is? So what a subluxation is that we've got 24 vertebrae from our head to our pelvis. And each vertebrae needs to move independently of the one above and below it. Now we have a nerve that comes out from every single level. Each nerve goes to three things. It goes to an area of your skin, a muscle group, and an organ system. So due to tight muscles, poor posture, poor diet, stress, instead of these vertebrae moving independently, they actually get stuck and they move together as a unit. That restriction is what we're calling as a subluxation, and this is what chiropractors treat. So when you have a subluxation, it's going to put pressure on that nerve that's coming out from that level, but it's also going to send a distress signal to your brain. And your brain is going to become constantly bombarded with bad information from that level, which is then going to spill over into the autonomics in your immune system and can throw your organs out of balance and can decrease your immunity. So when we're talking about subluxations, if we were to take a cross section of one of these nerves, this is what we're looking at. Each nerve has three components, like I just mentioned. You have a motor component of your brain talking to your muscles. You have an autonomic component of your brain talking to your organs. And then you have this sensory component, which deals with posture, pain, and temperature. The one thing I want you guys to really understand is that this sensory component that deals with pain makes up for less than 10% of all nerve transmissions. So what does that mean? You know, when I'm out in the community, I'm talking to people, networking and things, I always ask people, well, who's your chiropractor? Well, most people's answers are, well, I haven't had the need to go to one. I don't have any neck or back issues. But what I want you guys to understand is that pain only shows up in that most acute or extreme situation. 9 times out of 10, you're going to have a loss of function before you actually experience pain. And what does that look like? Somebody mentioned tension earlier. Okay? You have that tension in your neck or in your shoulders. That could be due to subluxations. You could have muscle weakness or spasm. It can affect your organ systems. You can have sinus and allergy issues, breathing issues, digestion problems. All of those types of things can happen when you've got subluxations in your spine. So how does that actually affect your digestion system? Well, I'm so glad you asked. So we have this vagus nerve that comes down from your brainstem. And you can see it innervates the heart, the lungs, the digestion system, the stomach, liver, gallbladder, pancreas, adrenals, all the way up into the first half of the intestines. So what happens is that when we have poor posture and we have subluxations up here at the base of our skull, it actually decreases the vagal tone or nerve stimulus to all those organs, and it can actually weaken digestion system. Okay? So just to kind of put that in perspective, what does decreased vagal tone do to the gut? Well, the causes are forward head posture, like I was mentioning, subluxations, a high sugar diet. People that eat a lot of processed foods and sugar is going to cause subluxations up here at the base of your skull. And then poorly managed stress is also going to cause subluxations up and through there. So when you have those subluxations, it's going to decrease and mute that vagus nerve and decrease vagal tone. And one way that you can check that is, well, when you're at home and you're standing in front of your mirror, right, bend your head forward once, bend your head backwards once, and come back to a neutral position and look at your ears. Are your ears level or are they tilted? If they're tilted, you've got a subluxation up there, and you've got something going on that's may not be a full-blown digestion issue, but you're going to have decreased function. So when you have this decreased vagal tone to your gut, what kind of effects happen? Well, you're going to decrease hydrochloric acid production. You're going to decrease enzyme secretions in the stomach, decrease bile flow, decrease blood flow to the gut, and then decrease motility, which can also lead to constipation issues. So this is what we're talking about with mechanical stress. Now, talked a lot about emotional stress. Somebody mentioned anxiety and stuff. So emotional stress is also part of that. So when we're talking about emotional stress, there's several factors in that. Number one has to deal with relationship issues with other people, right? Friends, family, coworkers, or boss. But not necessarily with other people, But how kind are you to you? That inner dialogue that we have that's going on. Are we really kind to ourselves, or do we do a great job of beating ourselves up? Because if we had a friend that talked to us sometimes the way that we talk to ourselves, would that person be our friend anymore? Right? Probably not. So we really got to take a much easier time on ourselves. Because really there's only two types of relationships that we have. You've got toxic relationships. The people that are always, coming at you and trying to push your buttons and keep you down and keep you small and based in fear. Or you've got nurturing relationships of people that are always looking to help out, lift you up, and support you in any way that they can. And then talking about anxiety, depression, and life stress. So we're just talking about anxiety and depression for a moment. Why do people get anxious? What's that? Fear. Fear of what? Okay. Fear of the unknown. Okay. Fear of failure. Okay. What about depression? Why do people become depressed?
The sun doesn't come out.
Lack of sunshine. I would agree with that. Yeah, exactly. Yeah, exactly. But these are all good questions because we don't really think about that. But there is different components to anxiety and depression. There obviously is a mindset or psychological component, but there also is a gut component and one of inflammation. And there's this book by Eckhart Tolle called The Power of Now that changed my life forever. And in this book, he states that people that are worried or anxious or always in fear, their mind is always in the future. People that are bitter or angry or depressed, their mind is always in the past. So we don't realize how much mental energy we are actually expending by being anywhere but 100% present. Because when we're worrying and stressing out, like you guys know people that are just always fearful and stressed out and worried about like everything. What's their health like? Is it great? Yeah, normally not. And this is the reason why. So it's trying to get back to that present moment because there's a difference between having a busy schedule and going from task to task, because all we have every single day is a series of moments. And there's a big difference between going from moment to moment and having a busy schedule and being in your head all day long versus having a busy schedule, going from moment to moment and being 100% present in every moment. There's a big difference to that and a different health outcome for each of those people. So that's kind of what we're talking about with emotional stress, because that is also going to affect the body differently and cause it to decrease in function. So we're talking about nutritional stress. Obviously, it has to deal with the quality of the food and what's on the end of your fork. That's a given. But this one people may not even know about, which is what your body can digest, absorb, and assimilate from the food you actually eat. Even if you eat a very clean and healthy diet, if you cannot digest it or you cannot absorb it, it doesn't matter. Your body is still going to treat it like poison. So it's like that old wives' tale, you are what you eat. Well, I take it that one step further. You are what your body can digest and absorb. Because if we were all able to digest and absorb our food and everything that we ate, well, guess what? Nobody would ever be sick. We just wouldn't. That's how the body works. But that's not reality. And we have stress. And our body decreases in function and can't digest its food. So talking about homeostasis. Homeostasis is the body's ability to maintain the consistency of its internal environment despite changes in its surroundings. So it's kind of like this internal balance. Now, the thing I want you guys to understand about homeostasis is that it forces relationships without exception. Now, what do I mean by that? How many of you have gotten sick? How many of you have lost your appetite while you've gotten sick? Ever curious as to why that happens? Well, when we get sick, we have a virus or bacteria that is trying to literally kill us. Your body is going to conserve all of its energy and put it into the immune system. Well, it also takes your body a tremendous amount of energy to digest your food. So if your body's not strong enough to digest its food, it's going to conserve all of its energy and put it into the immune system. So then you're going to lose your appetite. And it will come back. And you ever get it once it comes back, you're like ravenous, like, oh, let me eat, you know? Another example, you go out and go for a run, right? What happens? Your heart starts to beat faster. You start to breathe heavier. The blood shuns away from your digestion system because your body's not worried about digesting its food at that time. So these are just a couple of examples of how homeostasis forces relationships without exception. Because we have 11 organ systems that run homeostasis. And all 11 organ systems are totally dependent on nutrition to do their job. So when you have more bills than money at the end of the month, who do you pay first? Well, you're going to pay the one that's going to hurt you the most. And your brain sees it the exact same way. If a particular organ system needs a certain amount of nutrients, you know, your brain and your hypothalamus is going to rob Peter to pay Paul. It's like, we got to do that. That's what we got to do. It's a higher priority. Because your homeostasis' job is to keep you upright against gravity. That's its job. So when the body's inability to maintain homeostasis, this leads to the three stooges. We have compromised digestion, we've got muscle contraction, and then we have symptoms. So when we're talking about symptoms, let's talk about digestive symptoms. What are some digestion symptoms that people have that people normally associate with digestion? Well, you've got things like a loss of appetite, especially for meat, which brings me to a quick story. I had a neighbor of mine that came in, or she was having issues with meat. Like she couldn't even smell meat. Anytime anyone was baking or cooking like burgers or bacon, like it would really make her nauseated. So I'm like, you know, come into my office, let me check you out. Well, she was stressed out. She had subluxations up and through here, but there's a stress point that deals with protein digestion that was rock hard. And I'm like, this is the reason why. So I started adjusting her, gave her some digestive enzymes to help digest protein. Now she can smell meat fine. She can eat it, no problems, because our sense of taste and smell is directly linked to what our body can or cannot digest. Intolerance of fat or spicy foods. Food intolerance to dairy, gluten, or other sugars. Bloating, gas, abdominal cramping, constipation, diarrhea, acid reflux after eating, or the frequent use of antacids. So these are all common symptoms of digestion, compromised digestion. But what may be some symptoms that you may not associate with a digestion issue? Well, we have getting sleepy after we eat, that food coma that just doesn't happen after Thanksgiving, but may happen, I don't know, after lunch most days. Does that ever happen to anybody? Right? The inability to think clearly. What does your brain need for fuel? It needs glucose. What is glucose? It's a carbohydrate. If you can't digest carbohydrates, or you got blood sugar issues or digestion issues, you're not going to be able to think. You have a hard time focusing and concentrating, and you have that brain fog. Frequent periods of depression or mood swings, right? Sensitive to air pollutants or environment things, smoke, perfumes. Craving for thirst or cold liquids or foods are all signs of compromised digestion. So we could take a snapshot of what normal digestion looks like. Let's run through that. So it first begins in the mouth with chewing your food. Now, this is one thing I want to hit on later, but people simply do not chew their food. They take 3 bites and they swallow their food whole, and they wonder why they have digestion or health issues. So it begins in the mouth with chewing your food. Food enzymes in raw fruits and vegetables mix with the food in the stomach and the digestion begins. Pre-digestion occurs 30 to 60 minutes before enough stomach acid is formed, or hydrochloric acid. Now, people think that it's the hydrochloric acid that actually digests your food. It does not. The hydrochloric acid is there to create a sterile environment which the other stomach cells actually secrete an inactive form of an enzyme, and the hydrochloric acid just activates those inactive form of the enzymes, and that's what actually digests the food. So if you can't concentrate enough hydrochloric acid, you're not going to digest your food. Digestive enzymes are released in the intestines once the food leaks out, right? Your gallbladder contracts, your pancreas contracts, spitting out their enzymes and bile salts. You absorb the nutrients into the body, and then waste products are removed. So this is what a normal picture of digestion looks like. We're talking about abnormal digestion. We're talking about eating too fast or not thoroughly chewing your food. Want people to understand is that your stomach does not have teeth. So if you don't mechanically break it down in your mouth, what makes you think that your stomach's going to be able to digest that? It's just not. Eating enzyme deficient food. This is where your processed food, your fast foods, your genetically modified foods are all enzyme deficient, so you're asking your body to cough up more enzymes to digest that. Not eating enough raw fruits and vegetables. Your body cannot produce adequate digestive enzymes. The essential nutrients are poorly absorbed into the body, and the waste products start to accumulate, and this is where illness can occur. So when we're talking about compromised digestion, this leads to the three amigos. So we're talking about circulating immune complexes. What the heck is a circulating immune complex? So let's pretend that this is your meal. And let's say, there's maybe 60 or 70 Legos here. Let's say there's 1,000 or 1,500 Legos here. This is your meal. This is what your body needs to digest. The thing is that you have to break this down into 2 or 3 molecules so it's small enough so that it is easily absorbed across the gut wall and can get into your system and can easily be utilized by your cells and your organs. But what happens is that when we don't digest our food appropriately, 2 things happen. We have medium-sized pieces of undigested food, and then we've got larger-sized pieces of undigested food. So let's first talk about this. So you sit down to eat your meal. You're in a hurry. You're stressed out from work. You take maybe 6 bites, and you don't chew it. You swallow it practically whole. You can't produce enough hydrochloric acid. You don't have enough enzymes to digest your food. So now your food's leaking out from your stomach into your small intestines. And this medium-sized piece of undigested food is too big to be absorbed. So then what happens? Well, you've got bacteria in your gut. You've got good bacteria, you've got bad bacteria or opportunistic bugs, and then you've got yeast or candida. So they start to feed on this. And as we talked about earlier, when you start to feed on something, what happens? Well, you have to poop. So these bacteria are starting to feed on this, and they poop right there into your small intestine. And this is where the bloating and the distension comes from. It's gas. So now you have this gas that's in your small intestine that becomes toxic to the lining of your small intestine. Now that you have the presence of this gas, the integrity of that intestinal lining becomes compromised. These medium-sized pieces can now leak across the gut wall and get into your system. This is leaky gut syndrome. How many of you have heard of that? Okay. So now, these medium-sized pieces get into your system. What are your cells and your organs going to do with this? Nothing. It's too big. It's garbage. Right? They want something that's, smaller. They can't do anything with this. So who's got to clean up that mess? This is your immune system. So your immune system throws antibodies on there. This has now become a circulating immune complex. And your immune system has to clean this up. So now this circulates around and around in the body. And where circulation slows down is where these things deposit. So if these circulating immune complexes deposit in your joints and causes an inflammatory response, what do you have? Rheumatoid arthritis. If it happens to deposit in your joint or your connective tissue in your muscles, you've got fibromyalgia. If it happens to deposit in your lungs, and then you walk outside and there's a high pollen count, you can have an asthma attack. They also deposit in your sinuses, and you can have sinus issues or allergies, all because you've got circulating immune complexes which is coming from your gut. Make sense? Okay. So that's just the medium-sized pieces. We didn't even get to the large pieces yet. So the large pieces becomes the second amigo, which is bowel toxicity. So the same thing happens, right? You sit down to eat, you don't digest your food, it leaks out into the small intestine, bacteria are feeding on it, you've got the gas that's there, you've got leaky gut that's occurring, but these larger sized pieces are still too big to get across that gut wall. So now they continue on through the small intestine and end up in the large intestine. And along that transition time, they start to rot or putrefy or become rancid and ferment. And this is where this bowel toxicity comes into play. So when this food starts to rot, where do all those toxins go? Well, they get absorbed back into the body. And it still causes more work for the immune system to clean all that up. So now, you sit down to eat. You're in a hurry or you don't have the best quality food. All this is happening, you got leaky gut that's occurring, bowel toxicity. Your immune system is ramped up and has got to frantically go around and clean up this mess. So now the immune system is just about done cleaning this up. Guess what happens? Time to eat again. And this whole process starts over again. So can you see day in and day out, if you keep doing this and you've got a weak digestion system and your immune system is on overdrive, it's going to lead to the third amigo of weakening your immune system. How many of you know people that are just sick all the time? This is why. Their body doesn't have enough nutrients to run its job, and it's being overstimulated. So let's kind of dive into the small intestines. Let's really take a look at this leaky gut issue. So if we take a cross section of the small intestine, this is what it looks like. You got your muscles here, and then you got the inner lumen here. So let's take a deeper look at that. This is just a histology slide of that, where you can kind of see the same thing. Here's another picture of this, but what I want to point out here is, what are these things here? What are these big purple things? It's not here, but it's there. That's a good guess. Food. That's also a good guess. It is actually your immune system. Where's your 80% of your immune system located? In your gut. So these are what are called aggregated lymph follicles. And that's your immune system. That's what it looks like in your gut. So if we were to take the lumen and break it down, you've got all these little microvilli, you've got these columnar cells, and then you've got these columnar cells that have this microvilli on top of it. Now we have these microvilli because we have to have that increased surface area in order for our bodies to absorb all the nutrients. So if we were to take all of these microvilli in our small intestine and flatten it out, it would be the size of a tennis court. That's how much we got in our small intestine. So again, here's just another histology slide of that, looking at that. Okay? So when we're talking about leaky gut issues, there's two different ways that this can happen. You've got this paracellular leaky gut that's occur, you got these tight junction proteins here that combine the cells together. So when we have leaky gut or that bowel tox or the gas from the bacteria, it can destroy these proteins here, and then undigested food and toxins can get into our system this way. It can also happen transcellularly, which is much more of a severe thing, and this is what happens when we have ulcers, is it actually destroys the cells, okay? Now, how long does it take, when somebody has a weak digestion system, how long does it take for those gap junctions to break or to be destroyed? 3 minutes. How long does it take to heal it? Minimum 6 months. Provided that the stress has been removed. So here's just another picture of that. Again, we got healthy cells over here. We've got all the inflammation and damaged cells over here, which is unhealthy. So causes and consequences of leaky gut, right? You've got multiple causes, right? Your standard American diet, food triggers like gluten, dairy, grain, sugar, GMOs. How many of you know what GMOs are? You guys understand what genetically modified foods are? Okay. I have another lecture on YouTube called Food, Friend or Foe, where I dive into this. I highly recommend you look it up and look at that, because most processed foods are genetically modified, and we don't have enzymes to digest that, and is a big source of leaky gut and digestion issues. So take a look at that. Soda, alcohol, NSAIDs like Tylenol or aspirin. Do you guys understand that by taking one NSAID, it can cause microscopic bleeding in your stomach for 72 hours? What is the biggest complaint with people that take NSAIDs long term? Do you know? Heartburn, right. So GI stuff. It can cause bleeding and ulcers, absolutely. And there's over 17,000 people that die every single year from chronically taking Tylenol or an NSAID because it destroys their gut. Antibiotics, chemotherapy, stress, oxidative stress, heavy metals, infections, toxins, chemicals, and pesticides. So with the toxins, chemicals, and pesticides, this is a connection to the genetically modified foods because they spray Roundup and glyphosate on everything. So glyphosate is a poison. So sometimes people may not be gluten or dairy intolerant, they're just intolerant to poison. Oh wait, I forgot. So when you're looking at these things, it causes leaky gut, which then we develop more food intolerances. The immune system becomes abnormal, and then an autoimmune issue can occur. So this is what I want you guys to understand, is that our immune system, 80% of it is located in our gut. And we got two parts of the immune system. We got Th1 and Th2, but they have to be in balance. But what happens is that they can get tilted one way, and it can get locked there. This is where you have hypersensitivities with the immune system. This is where autoimmunity comes from. So let's just say that you have a gluten intolerant, and you keep eating gluten, and you can't digest it, and you're chronically stimulating the immune system. Well, then your immune system has, in about 5 years' time, you will develop an autoimmune issue if you do not remove it. Because your immune system, it learns. It is smart, it has an intelligence, and it learns. So if you continue to eat the same thing and don't handle your stress and strengthen your digestion system, autoimmunity is in your future. And they've now listed and categorized over 150 diseases as autoimmunity. All right. So here are some symptoms that are associated with bowel toxicity: digestion, sinus, allergies, asthma, fibromyalgia, low back pain, arthritis, thyroid issues. How many people know somebody that's on thyroid medication because their thyroid's all messed up? Yep. Autoimmune issues, lack of concentration, migraines, psoriasis, eczema, fast heartbeat, and depression. All symptoms associated with bowel toxicity. So what happens when the immune system is challenged beyond its capabilities? Well, you experience the cardinal signs of inflammation. What is that? FARS-P. What is FARS-P? We've got fever, abnormal motion, redness, swelling, and pain. Why do people go to their doctor? Why do people go to the ER? You think it's because they're feverish? They can't move a part of their body because it's swollen or it's red or it's causing them a lot of pain? That's it. That's what's going on. So chronic inflammation is all over and can cause so much damage in the body. So here's my question. I talk about chronic inflammation. So is inflammation a bad thing? Inflammation is a necessary process that is part of the healing response. It is the first thing that occurs to start the healing process. Where it becomes bad is when it becomes chronic. When inflammation is chronic and is always turned on and it is always present, it is going to cause so much damage in the body. Not necessarily systemically, but also in your brain. Okay? So you got autoimmune issues, metabolic issues, bone and joint problems, lung issues, diabetic, neurological, cancer and cardiovascular issues, all from chronic inflammation, right? It was all over the news. This was back in 2004 that this came out. So, what do the Three Stooges, the Three Amigos, and FARS-P, what do they all have in common? These are all signs of enzyme deficiencies. These are not signs of cough or cold, anti-inflammatory, antacids, or laxative deficiencies. We don't get sick because we have a lack of NyQuil in our bloodstream. We don't get a headache because we have a lack of Advil in our bloodstream. Something was supposed to happen in our body. Our body was exhausted, didn't have the nutrition to combat it, so then something didn't happen and it broke down. My mentor, Dr. Loomis, in his book, Enzymes, The Key to Health, he states that vitamin and mineral deficiencies result in acute symptoms. But it takes some time for enzyme deficiencies to be seen, and they manifest as chronic degenerative diseases. So let's kind of review what we just went over. So we got stress. What are the three forms of stress? All right, you guys are paying attention. All right. So it does not matter to your brain what form, what combination, or how long it's been there. Your brain and your body is going to do the exact same thing every single time when it comes to stress. Two things are going to happen. The first thing is that we are going to burn more nutrition as a result of that, because your body combats stress with nutrients. So when you become nutritionally deficient, you're going to have muscle contraction somewhere, which is the tension that you were talking about earlier, and cause other issues. The second thing that's going to happen is your body is going to become more toxic because you are trying to burn that faster. When you become nutritionally deficient and you create more waste, guess what the one thing is that you burn up? This is where the enzyme deficiencies come from. And what are the two main systems that run on enzymes? Digestion, immune system. What were the four top selling over-the-counter medications for? Immune system and digestion. Do you think that's a coincidence? So when your body becomes deficient, you can't digest your food, your immune system becomes weak, and this goes on long enough, what's the next thing that happens? Well, this is where you have inflammation, FARS-P. If it goes on long enough, What's the next thing that happens? You're going to have lymphatic congestion. What does the lymphatic system do in the body? It collects all the waste and toxins from your cells and just regular metabolism. So when your lymphatic system becomes congested and your body can't get rid of these toxins just keep circulating around and around and around and around in the body. And then ultimately, over time, you're going to get hit with a chronic degenerative disease. I don't know if you guys understand this, but the top 10 leading causes of death in this country, 7 of them are related to chronic degenerative diseases. All 7 of them are preventable with diet and lifestyle. So if you don't want to become a statistic, you have to take action as we get older. So what do you think would happen if we were able to identify exactly where your source of stress is on your body? What do you think would happen if we could identify exactly where those enzyme deficiencies are, what organ systems are malnourished, and then get those organ systems the nutrition that they need? Because if we find the stress and minimize it or manage it better, we nourish the body, do you think we could prevent this from even occurring? Say yes. So that's what I do. This is what happens when people come in to see me. So Selye says that it's not stress that kills us. It is our reaction to it. You can apply 2 people the exact same stress and they're going to respond differently. Not everybody likes to public speak, rock climb, or go skydiving. Some people may find that invigorating experience and will scare the crap out of others. So it's not what happens to us, but it's how we handle it. So I was trying to look for a stress management tool. I was trying to figure out, well, what could happen if I could find something that it didn't matter where you were, that you could whip this tool or this kit out and your stress would ultimately just go away. So I was looking on the internet and trying to find this. I was talking with colleagues, and this is what I came up with. So I don't know if you guys have ever seen this, but directions: place kit on firm surface, follow directions in the circle of the kit. Repeat step 2 as necessary or until unconscious. If unconscious, cease stress reduction activity. So I thought that was kind of cute. I just had to throw that in here. All right, so we've talking all this stuff about enzymes. What are they? Let's talk about enzymes. Enzymes are a protein molecule produced by living cells that catalyzes chemical reactions in all organic matter. They are the workers of the body that make your body work. Although the actions of enzymes cannot be seen, they are the driving force behind virtually every biochemical process that occurs in the body. So Dr. Howe, in his book, Enzyme Nutrition, he states that enzymes are substances that make life possible. They are needed for every chemical reaction that takes place in the human body. In both maintaining health and in healing, enzymes, and only enzymes, actually do the work. Let me say that again. In both maintaining health and in healing, enzymes and only enzymes actually do the work. What does he mean by that? If we were to look at the human body and to look at all of the raw material that the body needs to thrive, we've got your macronutrients, your proteins, your fat, and your carbs. We've got your micronutrients, which are your vitamins and your minerals. And then you've got water. Which one of those macronutrients and micronutrients actually has the capacity to do something? None of them. Enzymes. Enzymes do 2 things in the body. They take one thing, they act on it, and they break it into 2 pieces. Or they take 2 pieces, they act on it, and then build something. So they digest and they repair. That is the only thing enzymes do in the body. So let's just say that we wanted to build a house. We have this huge pile with all of the materials sitting there, the wood, the concrete, the tools, the nails, the windows, the shingles, the doors, the electrical, the wiring, all that. Well, is that material going to actually build the house? No. You need the workers to put everything together. What if we had 2 workers that were working on that pile? Well, that's going to get built in a certain time frame with a certain amount of efficiency. Well, what if we had 10 workers working on that? 100, 1,000, 10,000 workers. You can see how that material is going to get built and the house is going to get done a lot quicker. That's what enzymes do in the body. They digest food, they strengthen your immune system, and they burn up all the toxicity. So we must follow nature's law. Enzymes have been removed from our diets. Cooking kills enzymes, and the processing of food kills enzymes. Why do you think a food packaging company can make a food, put it in a box or a bag, it sits on a shelf? You come along, you take that down, you take it home, it may sit in your pantry for a week or so. You take that down, prepare it, and then you eat it and you think it's nourishing you. What would happen if we did that with a box of apples or bananas and it sat for 2 weeks? Will you still be able to eat that stuff? Yeah, probably not. What's the big difference? When we process food, we remove the enzymes from that. It creates a greater shelf life. Apple falls off a tree, hits the ground. You come back a day later, pick up that apple, what do you see? Bruise. What's the bruise? Enzymes. When it hits the ground, it destroys the cells that are there. It liberates the enzymes that are inside the cell. The apple is starting to digest itself. That's what a bruise is. Anything above 118 degrees Fahrenheit destroys and denatures the enzymes. Right? Enzymes are a protein molecule. A protein molecule is a tightly wound molecule. You crack an egg, you try to fry an egg. It comes out of the egg clear, but then as you add heat to it, it becomes white. Those protein molecules start to unravel. That's why it becomes white. Now, I'm not suggesting you go out and eat raw food or raw meat, but that's what happens. Okay? All right. You guys are going to like this. So to show you the actions of enzymes, we're going to recreate this and pretend, doing a little experiment here. So I got freshly made oatmeal that I made. We got 2 cups here that is going to simulate our stomach. And I'm going to add enzymes to one and show you how they work. Okay, so one's going to be our control. Okay, got a little box of Zymes. I'm going to take out 2 digestive enzymes. And we're going to place them in this one. Okay. So now we're going to pretend that we're in the stomach, and I'm going to start to move it around. Whoa. Okay. And get our control. And we're going to mix this up. So as you can see, it's pretty sticky and just, you know, it's oatmeal. Notice anything? What do you notice? Look at that. No enzymes. All right, still very glumpy. And then look at that. So where'd the water come from? Look at that. Isn't that cool? So enzymes break things down. And when it does, it liberates water. Pretty cool, huh? Okay. So, eating hygiene, proper eating hygiene. There's a lot that you can do. It's not all doom and gloom, I promise you. Because what you guys have 100% control over is what's on the end of your fork and your ability to chew your food. So you guys have a lot of power and control over this. So when we're talking about proper eating hygiene, what does that look like? Well, time is our biggest commodity. We simply do not have the time, or shall I say, we do not make the time to sit and eat. Because shopping for food, sitting and preparing the food, taking the time to eat the food and then clean up, it just takes time to do all that. But we just don't make the time to do that. I mean, how many of you like to eat? It's fun, isn't it? So why not really make the time for that? Make eating a family affair. If you've got kids, the best thing you can do is teach them how to cook. I got a 12-year-old daughter that, I show her from time to time how to cook certain things. All right, the fork rule and chewing your food. Like I said before, your stomach does not have teeth. And for whatever reason, this seems to be the hardest things for my patients to implement, and I do not know why. But when the next time you eat, I challenge you to the fork rule. What the fork rule is that I want you to sit down and eat. Take a bite of your food, put your fork down, and then chew, and chew, and chew, and chew, and chew, and then chew some more. And then chew some more, and then chew some more. You think you're done? No, keep chewing. Each bite should be a liquid soup before you swallow it. Then, and only then, pick up your fork and take your next bite. If you can do that, you'll notice two things. Number one, your jaw's gonna hurt. And number two, you're gonna eat less food, because you'll actually get more nutrients out of what you are eating. Have 5 or 6 smaller meals a day. Some people eat 1 or 2 big meals a day, and our stomach can't handle that, and it's rough on our digestion system. So eating more portion-size controlled meals is easier for your body to handle that. And then eat until you're 80% full. You're sitting here eating, and you get to that point, and you're like, yeah, stop. Don't keep eating. All right, what's your favorite exercise? Chewing. Now, when it comes to diet, people try to make diet so hard and complex. It's not. Eat whole food, period. Not food-like substances, not chemicals, not toxins, but whole food. What do you avoid? Processed food, genetically modified foods, dairy, canned foods, fried foods, refined sugar, sugar substitutes. What do you eat? Well, you eat fruits and vegetables, whole grains, seeds, nuts, and your lean meats. Your fish has to be wild caught. Any farm-raised fish is genetically modified. Pasture-raised chicken and turkey, and grass-fed beef. You want to look for the non-GMO verified on everything that you buy. If you want to be healthy, you have to do this, period. You have to buy stuff that is organic. Our food supply is so tainted and it is not nourishing our body. which is what a big part of why we have such a rampant in autoimmune issues and chronic degenerative diseases. So if you want to be healthy, you have to do this. It's no longer an option. Any questions on that? Does it make sense? Okay. What have we learned so far? Well, we now know what stress is. We know that all symptoms are caused by stress. Homeostasis must be maintained. We know what normal digestion looks like, the importance of enzymes, and that plant enzyme supplements can restore homeostasis. So can enzyme nutrition help you? Well, do you have a chronic unresolved health issue? Do you want to restore your body's balance? Are you seeking answers to your health problems? Do you want to feel better when you eat? Or do you want to simply be more proactive with your health so that when you get to your golden years, you can actually do stuff? Well, if you've answered yes, then enzyme nutrition is for you. So how do we evaluate the digestion system? Well, there's different things, different pieces of the puzzle that we need. The first thing that needs to be done is I'll have you do a symptom survey, because I want to know from a symptom perspective what you're experiencing. What are major issues? What are minor issues? Then we're going to do a food diary. You're going to record everything that you eat and drink for 6 days, because I want to see what you're putting into your body. We're going to do a 24-hour urinalysis, which tells me from a chemistry perspective how your body is actually handling your food. And it can tell me a great deal about your digestion system. And then we can do blood work. We can check to see if there's an infection or leaky gut issues or any food sensitivities done through blood. And then we can do a fasting digestive exam. And what exactly is that? Well, we've got different visceral stress points on the body. There's over 40 of them. So you're going to come in first thing in the morning on an empty stomach. I'm going to adjust your spine to minimize all of the mechanical and neurological stress to your system. I'm then going to evaluate your posture and take a look at these stress points to see which ones are positive. Then I'm going to give you a balanced food to eat, which is a tablespoon of food mixed in water. You're going to drink this. We're going to wait 45 minutes to allow your body to digest, absorb, and get that nutrition to where it needs to go. Because on an empty stomach, your body's waiting for its next meal. There's going to be nutritional imbalances. So that's to be expected. So you have these that are positive before. Well, then once you drink the food, if they're still there afterwards, well, that's where your body's having a hard time getting that nutrients where it needs to go, or that organ system. Well, what if you've got 20 things that are double positive? Like, where do you start? The biggest thing I want you guys to really understand is that homeostasis works in a predictable manner, and there is a priority system in how it takes place. So when you get to the top dog that makes the priorities and makes the decisions, everything else will naturally follow the chain of command. So that's how we evaluate your digestion system. Then once we find out, because what this does is that if this is normal, this shows me where your deviation from normal is at. Then once we find it, it's like, oh, look, right here, this is where your source of stress is at. Then we put you on a program that will bring your body back up to balance. And what does that program look like? The very first thing that needs to be done is that we have to identify where is your primary source of stress. Because your stress is going to be different from yours, from yours, from yours. Everybody's different. Some people's stress could be more mechanical as their primary. Some people's stress could be more emotional, or some people's stress could be the nutritional or the diet. It's different for everybody. So if you do not find that source of stress, if you do not minimize it or manage it better, your body will simply not heal. Period. It's how the body works. This is what I've become an expert at, in being able to identify this on people's bodies. The second thing is that we're going to modify your diet. If your body is having a hard time with protein digestion, we don't want you eating a lot of protein. If you have a hard time with carbohydrates or fat, then we're going to modify that based on what we find in this evaluation. The third thing is a home care program. When we talk about specific stretches and exercises to help minimize your structural stress on your body. that you're going to need to do on a daily basis. Chiropractic adjustments will be involved with that. And then lastly, some enzyme supplements to help rebalance the body. So what is my job? My job is to identify where that stress is at, minimize or manage it better, support normal function, give your body the time and space it needs to heal. Because here's the beautiful thing. If you can do all these things, your body has the intelligence and the innate intelligence and homeostasis. That's what does the healing. We just got to support it. We just do a really good job of abusing our bodies mechanically, emotionally, and nutritionally to a point that it can no longer compensate and gives us these symptoms. But if you can follow this, it really isn't that difficult. It might seem like a lot, but it really isn't. And the body just does the rest. That's what makes my job so much fun, is that you can count on this every single time. But then the last thing is to educate you on how to manage your body and your health better. Okay, so I have a couple testimonials. All right. I'm not sure the cause, but my health has been deteriorating for about 2 years. I've been dealing with acid reflux for about 8 months, getting constant sinus infections, taking tons of antibiotics, gaining weight, losing my energy and zest for life. I felt like I was growing old before my time. I could not sleep at night, was afraid to eat, depressed, lost my interest and joy for doing things in life. All I wanted to do was lay in bed and watch TV. I tried to address my issues with several different medical doctors. I was treated by a gastroenterologist who put me on 2 acid reflux medications. I was treated by my internist with antibiotics, and I began to get allergy shots for my allergies. I also used 2 nasal sprays for my allergies. The only difference I experienced was that my acid reflux continued, only slightly improving in the daytime. I continued to get sinus infections every other month, and I still had no energy and just felt bad all the time. I explored the internet for a chiropractor in my area who did digestive work and decided to try that because everything else had been so ineffective, and then I found Dr. Keith. Since being treated by him with enzyme nutrition, I've had amazing results. In just 4 months, my life is completely different. I feel like I used to in my 20s. I have tons of energy, sleep at night, and feel refreshed in the morning. The best of all is that my reflux is gone. I have my life back again. I have not been sick for 2 months now and have had no sinus infections or any illness of any kind. This is fantastic for me. As an added benefit, I've lost 15 pounds without even trying. The weight just melted away. I have my life back and I feel so lucky. I am sending all my friends and family who are not well to Dr. Keith. He is amazing. One other thing, another testimonial. My 6-month-old daughter, Colette, was experiencing severe digestion difficulties, stomach cramps, bloating, gas, constipation, and insomnia since she was born. Every day, she would scream for 2 to 3 hours because she was in so much pain. Colette was only sleeping 30 to 90 minutes at a time because of the amount of pain and discomfort she was experiencing. Needless to say, after 6 months, my husband and I were exhausted, physically and emotionally. We felt helpless and hopeless that our little girl was suffering so much. We have seen 7 different doctors and specialists. They have all said the same thing. She's on the wrong formula. That was their treatment. We switched formula numerous times with no results. We were referred to Dr. Keith by our pediatrician, and after our first appointment with Dr. Keith, we noticed a dramatic difference. Colette no longer screamed in pain for 2 to 3 hours per day. She slept soundly and had regular bowel movements. Continue with treatment, Colette's bloating and gas disappeared, and she is now sleeping 5 to 6 hours at a time, like a normal baby should. My husband and I were absolutely thrilled with the results and that Dr. Keith was able to get for Colette and us. Thank you from the bottom of our hearts for helping us to experience life without daily pain. I had forgotten how it felt to have a normal day. And what was a big thing with her is that she had a huge subluxation at the base of her skull, and her pelvis was twisted. So when you're subluxated at both ends, your spine is twisted like a dish rag, and it affects the vagus nerve. I started adjusting her, gave her some digestive enzymes, and the body did the rest. It was beautiful. It took about 4 weeks, and she was back to normal. It was awesome. So, last one. Had a 14-year-old female with eczema that's been dealing with this on and off for about 8 years. She's had chiropractic care before, but has never had her gut looked at. So why would you take somebody that has eczema to a chiropractor? Well, this is what her hands looked like when she came in. See how red and swollen they are? Started adjusting her consistently, worked on her gut. Her big problem was that she couldn't sleep. We got her to sleep better, strengthened her gut, cleaned it out, and look what happened. How long do you think that took?
6 weeks.
6 weeks. 2 months. Good guess. Took 2 months. This is why I do what I do. People don't know what they don't know when it comes to health. So I thank you guys for coming out here. I'm not done yet, but thank you guys for coming out here to spend your time here with this. All right, so let's summarize what we've gone over. I'm going to wrap this up in a nice, neat little bow for you guys so we can get you out of here. All right, so stress, men, it disrupts the nervous system and the body's ability to function normally. You're going to decrease that vagal tone, which is going to weaken your digestion system. Leaky gut and immune activation is then going to occur. Your body becomes malnourished and then exhausted, causes subluxations, and this vicious cycle continues. You want to know what the kicker is? If you can properly digest your food and break it down small enough, guess what? Your immune system has absolutely nothing to react to. Diet, lifestyle, chiropractic care, digestive enzymes. It really is that simple. Because your body really only has to do 2 things. It has to keep you upright against gravity, and it has to maintain homeostasis. And both of those things require nutrients or energy. Every single cell in your body asks the body to do 2 things. Give me my food and take away the waste. If you can do that efficiently, that cell, that tissue, that organ system will do its job very efficiently for a long period of time. And then nutritionally, you have to digest the macronutrients, make sure you've got the right micronutrients in there, and put in the enzymes to do all the work. It really is that simple. So now you have 2 choices regarding your health. You can do the same thing that you're doing now and get the same results, or you can try something new, do something different to get different results. The choice is yours. So that's why everybody that is here that is not my patient, I'm giving each and every one of you a gift. And this gift is an opportunity to come in and see me. When you come in to see me, I will do a screening on you. I will check your posture, I will check your spine, and I will screen your digestion system to see if there's any digestion problems going on, and I'm going to do this at my expense. Because I don't want anything to get in the way to see if I can help you with your health. I'm here to serve people. So if you're interested in doing this, there's a check mark on the bottom of that stress survey. I want to collect those at the end. Check off that you want to come in. Or I also have a schedule here for this upcoming next week, if you know what your schedule is, for time slots. I'll put this in the back there that you guys can sign up here tonight. Okay? There's 4 reasons why you should do this and accept this gift. Number 1, health problems get worse if they're not treated. If I'm able to help you and to improve your quality of life, you're going to get more out of it. And feeling good and being happy is what life is all about. I'm not going to waste your time or money. If I can't help you, I will let you know. And then you have nothing to lose because I'm going to do this screening at no charge to you. So now the choice is up to you to decide what you want to do. And this is the beginning. One last thing that I want to mention is that I have a couple other lectures up on YouTube that I mentioned earlier. Also, I am starting a health educational series called Body Talks. I've got 2 videos up on YouTube already that you can look that up, because I'm noticing that there is a gap in patients' educations when they're coming in to see me. So I'm creating my own health education series to help educate you on some of the stuff that we've talked about here tonight on homeostasis and everything. But I'm going to be creating more episodes and things to really dive in and teach you more about how to take care of yourself, how the body works, because ultimately you have to be your own health advocate. And it takes education and time and some professional support. And that's why I'm here. I'm here to help serve you guys. So thank you guys for your attention. If you guys have any questions, I'd be happy to hang around and stick around. Thank you.